Good afternoon. I'm Dr. Sandra Martell. I'm the public impacted our hospitality industry, including restaurants, bars, and the travel industry, our cultural institutions, museums, performing arts, our sports, from schools to the professional competitions that we normally would host, to our students who have missed proms and graduations and homecoming and their sports, to our communities of concern, including our minorities and people of color, who experienced higher hospitalization rates and higher mortality rates, to our locations of concerns, our individuals in the congregate care settings. Throughout this, they've been isolated and have also suffered for increased mortality and death. You're right, unfair. And now we come to vaccinations. Appointments are not being provided by any system within Winnebago County unless vaccine is available. And it's important to understand that's why people who have registered have not gotten appointments yet, because we can't schedule too far in advance without an adequate supply of vaccine. Everyone is working to vaccinate as quickly as possible. We know the state of Illinois has a phased approach, and we're also applying an equity lens against that phased approach. So when you call, or when you write us, or when you want to talk to about being unfair, think about what can you do to encourage and support vaccination efforts. Instead of saying it's unfair, you have to register online, help a neighbor register on the variety of systems. We've said before, take vaccine from the first system available. Limit your emails and contacts to health system providers who are working to schedule and provide vaccinations. Be kind and respectful to the staffs that have been working throughout this pandemic and are taking the calls. Remember, it's been unfair to them as well. Do not personalize when you call. Nobody is deliberately denying or not giving someone a vaccine dose. We're in a phased approach. And please do not call and ask for favors. The stories of every single individual in our community are compelling, but we can't manage the individual personal requests. While this pandemic is not fair, you can choose how you respond, and choose to respond with kindness and equity. We are working to make this and be able to vaccinate as many people as effectively and efficiently within phase through an equity lens as possible. Healthcare providers are focused on vaccinating their enrolled populations who have had an encounter in the past 18 months. I'm often asked, well, when is my turn? When do I get it? So all of our healthcare partners, Crusader Community Health, OSF Healthcare, Oak Street Health, UI Health, LP Johnson Miles Square, Mercy Health, and Swedish American Healthcare are all working through their client enrolled populations. And the majority of the vaccine has been allocated to these healthcare systems based on their enrolled patient numbers. But vaccine supply is currently not adequate to cover everyone who is eligible in phase 1B. And if you're following local, state, national media, you know that that is the case. And the healthcare systems are prioritizing based on age and comorbidities. Because I've heard, well, why is someone who's 65 receiving it ahead of someone who's 75? Well, the 75-year-old may only have one comorbidity, and the 65-year-old may have 5 comorbidities and be in one of these frontline worker positions. So the healthcare systems are working out various methods. It could be through their MyChart. All of our systems use Epic for the most part, the 3 hospitals. And again, if you've not enrolled in MyChart, they'll reach out to you by telephone. Some of them are actually engaging community outreach workers like Oak Street Health, or email. But I want to remind the public, get vaccinated at the first available opportunity and keep your appointment. That vaccine dose has been reserved for you when that appointment is made. That means they have the vaccine available. and it is got your name on it. If you have registered online with Winnebago County Health Department and have received an email confirmation, you are still on our list and will be notified when we have an appointment available for you. You can decline that appointment if you've been vaccinated elsewhere at that time, but you've not come off the list. Winnebago County Health Department and select partners, including Marathon Health, Rosecrans, Winnebago County Wellness at Swedish American Better Life Wellness, are focused on vaccinating frontline workers in Phase 1B and catching up Phase 1A outside of the healthcare systems. So today I want to do a shout out to Rockford Public Schools and my nurse colleagues and staff support there that we started vaccination teachers in the RPS system. We are also reached out, I hear, are we also doing private schools? Yes, we are working through every system. But just like every place, we're looking at those that have the largest population base first. We also are going to be reaching out, and we started the contacting of our food processing plants in Winnebago County. We're continuing with our first responders. Some of our first responders may be vaccinating in a school with that teachers group if they're in an associated area. Our grocery store workers, think of our Big Myers and our Woodmans and our Schnucks and our Aldis. All of those individuals need to be vaccinated. They were essential front line. They did not have the choice to stay home when we were in our stay-at-home all-in for Illinois. These individuals were deemed essential and continued to work in person throughout the pandemic. So it is a process and it's a plod. We talk about the marathon. But again, while it may seem unfair, we are working through to fairly vaccinate, to ensure that everyone who wants a vaccination can receive it. But I want to keep reminding you, it won't be tomorrow. It won't be next week. Your neighbor may be vaccinated ahead of you. Someone sitting in your car may be vaccinated at a different time in your household, depending upon where they are in the phases. Today, we're reporting 69 new cases, which brings our total case count up to 25,963. The good news is our rolling 7-day positivity rate is at 4.7%, and we have no additional deaths to report. But our total residents of our community lost to COVID was over 400 at 404, and no new locations of concern. And Rosecrans Harrison campus has completed 2 incubation periods without any new cases. And as of Monday, Rockford hospitals, including Mercy Health, OSF Healthcare St. Anthony Medical Center, and Swedish American, are providing care for 50 patients who have tested positive for COVID-19 and persons suspected of COVID-19 positive. This is an increase from Thursday's report of 48, and again, we will release those numbers again on Thursday afternoon as we have. So while we are in this phase 4 of the Restore Illinois plan, and we're in phase 1B of vaccination, and we are no longer under the tier mitigations, we have to continue our vigilance on this. We have to continue to wear our face coverings, maintain our social distance, stay home when we are sick, and when our term comes up and we get an appointment, we should make sure that we take the first available appointment and get vaccinated. And remember, again, to be kind and respectful to each other, to understand that this is a long process that we are working toward, but everyone who wants to be vaccinated will be vaccinated.